Welcome, everyone. Good morning, good evening, good afternoon. My name is Angela Love-Zaranka, and I am one of the IBCLCs at Lactation Education Resources. Welcome today.
Yes, I second that, Angela. Welcome. I am Sekeita Lewis-Johnson, and I am the lead nurse planner for LER, and I am so glad to be here today.
So just a little bit of background about what we're going to do. I want to just give you a little bit of an orientation as far as how we're going to organize today. So as I said, I'm Angela, so I'm with Lactation Education Resources. And just to give you a brief update of what my background is. So I have been a community breastfeeding counselor for over 30 years. I've been board certified as an IBCLC for 20 years, and I have been helping people to become candidates for the exam almost since I became an IBCLC myself. I've also served on the IBLCE board of directors, that's the examining board, and recently the ILCA board of directors and other governing bodies around the world that regulate and or talk about and or advocate and support lactation care providers around the globe. What about you, Sekeita?
Our experience of being in this work is about the same. I've been in the labor and delivery field, well, a little bit less than yours, but about 20-something years in maternal child nursing, also an IBCLC for about 12 years. And so I feel like I just sat for the exam in 2018. So I've had the opportunity to take the exam twice now. So I really empathize with those that are on this call today. And I've done it not too long ago myself.
So we understand, we understand where you are and embarking on this journey, and we're really excited for you. And so just want to give you just a little bit of support there and let you know that we're here for you, and we know some of your journey and what you're going through. So Sekeita, you want to talk about our objectives for today?
Yes. Okay, let's get this started. So today, this meeting is to help you get organized so that you'll feel prepared when it's time to sit the exam. Understanding that nerves are high before the exam. Sometimes it's really all about, I use the phrase, checking your temperature before starting and just kind of doing a little relaxation. So we're going to talk about those things and find a way to come back down without feeling so anxious. Sometimes our bodies forget what relaxation looks like, particularly if you've been studying, and then you have family life. So plan something good for yourselves after the exam. Anticipation will really help you get through it. So we're here to talk all about preparation for the exam. So this presentation should be helpful if you are taking the exam in the next 90 days. Or taking the exam in the next year. It's best to get organized about 60 to 90 days before the exam. So today we'll walk you through a plan so that you can feel calm, prepared, and happy about this journey that you are embarking on. So first, I'll talk about how to study for the International Board of Lactation Consultant Examiners exam. Sometimes you will hear this said, just phrased as IBLCE, and sometimes you will hear folks say IBLCE. All means the same thing. So start making flashcards now. Even if you plan on doing your test exam next year. If you took our 90-hour course and still have access, review the entire course. Look over your notes that you took from the course. And if you've attended webinars or any in-services given by lactation consultants, you also want to take a look at those as well. The best advice that I would pass on is just to relax about memorizing the entire core curriculum. So things like the cranial nerves or all enzymes or living cells, you don't have to know all of that, and you don't have to worry about remembering all of that. So how to know what to know. This is probably what the most people are in this space to know about. So it's not really possible for you to know everything that is fair game that's on this exam. This really is a comprehensive, broad-based certification exam, so it's a lot of material. However, it's not everything. So the range of information is virtually limitless, and the IBLCE has said that everything that has been published in books or journals may be included up to this past year. And that's a incredibly a large amount of knowledge. However, keep in mind that this exam is an entry-level exam, and it's designed to separate those who will be the competent novice lactation practitioner and those who just simply won't be safe working with families. So I hope this puts your mind at ease when I say it's an entry-level exam. Since the exam is very practice oriented, the more experience you have, the better. And when I say practice oriented means practicing, you've been working with families or working with lactating individuals. So if you've only practiced in one setting, you may want to consider widening your scope of practice by attending a support group meeting like La Leche League, or visit a clinic where lactation support and clinical care are offered, such as the WIC program in the United States. Assist in a pediatrician's office, possibly visit a NICU lactation consultant, or follow someone in a private practice. Now, I know with the pandemic, some of these experiences may be challenging to achieve, but as restrictions have been loosened, it's worth a try to see if you could get any other experiences that may just be a little different than what you've already experienced. Because even a few days of observation in another setting can be very enlightening, not only to your practice, but also to your thought process and perspectives on how you view certain clinical issues that come up in lactation. So all of this to say, try not to put off studying or getting your experiences until the last minute just because you're dreading it. So pace yourself, don't get overwhelmed. And again, the earlier you start, the better off you'll be. So LER has a Facebook group set up for our students from either our lactation consultant training program or the exam enriched course. It's not an open group. So you'll need to send a request. You'll need to answer some questions in order to be added to the group. But this is a great way to discuss sticky questions, share resources, and to locate someone you could actually physically study with. And when I say physically, that takes on a whole new word right now. Physically is sometimes I feel like this platform we're on can be physically because you're seeing and you're interacting. Again, keeping in mind the pandemic and your location in the world, not really sure what's happening in those spaces, but it would be nice to have a study buddy in your area if you can. If you don't, you can try to find a local study group or a small online group of people with different backgrounds, but those who are committed to consistent study and meetings. If there's even a couple of you in an area getting ready for the exam, it helps to really bounce ideas off one another, share anxieties, share resources, and sometimes just share, just talk off topic for a little bit, because you're there to study. But if you don't know anyone in your area taking the certification exam and would like to meet safely face to face, or you just want to find someone to meet, put a request in our LER IBLCE exam study group on Facebook and see what happens. Use of the study guide we provided for you in the handout sections or use, I should say, the study guide that is provided for you in the handout sections or attached to this recording to plan your strategy. Plan your study time when you're most alert. For some people, that is in the morning, but for others, say for instance, if you would typically work during the night, that could be when you're most alert, but just make sure you pick a study time when you're most alert and pick a time when you are least likely to be interrupted. If you have a family, you may have to negotiate with your family for some time when they agree just to leave you alone, to not interrupt you. If you have kids, consider creating a family project to help you pass the test. So get them involved in your learning, and they can also learn some things too. So if you look at this screen, this is a screenshot of the 30 days handout. It provides a list of topics on the IBLCE detailed content outline and activities to help you prepare. Please note that it's a 30-day plan, and I know I've been saying 60 to 90 days, but this is a 30-day plan. Of course, it's best to start more than 30 days ahead. So again, you can start now, or at least, as I said before, the 60 to 90 days, and plan when you can work on each topic. You may want to spend about 2 to 3 days on a topic that you're not really familiar with. Others, if you're familiar with them, you can spend an afternoon reviewing the content, but pace yourself. If you start way in advance, you can plan a few days off for family obligations, or you can take a break for your brain. All of those things are important to consider when you're preparing for this exam. But this handout can be found as an attachment to this webinar, either live or recorded. This is more of a visual plan. This is a general idea of what a sample study plan could look like. Planning out dates, content, and study partners can help you to remain on track and accountable. Of course, there can be urgent and emergent situations that arise, so it's important to remain flexible. Yet again, I cannot stress this enough, don't put it off till the last minute. So you want to prioritize accordingly. Angela shared this experience that she and her friend developed a unique way of studying. She had some textbooks, her friend had some textbooks, and what they would do is they would choose a topic that they would study with their books. Then they would meet and review the similarities as well as the differences in the information. And if they found a conflict, they would find other resources to review to come to a decision on the best information available at that time. Keeping in mind, yes, there are discrepancies. And so with that being said, I think that's an awesome study plan. It's just to have people to bounce ideas and topics off of. So if you check out this visual plan, it's very detailed. If you see the stars are there indicating what's happening on those days. And you know, some people are visual, so this helps. Other people are linear, so just creating a list. But whatever works for you, try to find that right fit. So personal study, just get organized. I just talked about a study plan. That's the first way to get organized. Secondly, you want to pull all of your textbooks, your lactation course study materials. You can set up a place that's dedicated to your exam efforts. Set up about an hour to an hour and a half block of time to do the readings and practice tests in this program. Study sessions should have the same weight as any other important commitment. Try not to skip or put it off. Personal study is essential to your success on the exam. And research shows that material that is learned over a long period of time is retained better than cramming at the end. And also repetition really helps. Even if you made it through high school or college using the last minute cram strategy. Don't do this for this exam. It's so important. Be prepared. A reasonable amount of time of study will make you confident as well. If you have a lot of experience and say you were resitting or you're taking the exam for a second time, make the time to study. Sometimes we get so confident, like, oh, I know this. Don't assume that you can pass without studying. If you've been actively practicing as a lactation consultant and keeping up with your readings and attending conferences, maybe you can pass without studying. That's a maybe. But you would feel awful if you don't. And maybe your job will hang in the balance. I remember when I sat for the exam the last time, and it was a thought. I was working in the hospital setting as an IBCLC, and the thought was, what if you don't pass, right? What does that look like for your job? So please plan study time. Reward yourself with whatever you like at the end of your study session, similar to the recommendations we give to parents who may be exclusively pumping. There have been many parents who will give themselves a little treat every time they finish a session. Do the same for yourself when you're studying. Take a hike, get lost in a favorite social media platform. You can really get lost, so try to keep that to a minimum. Take a relaxing bath, watch an episode of a new show on a streaming platform, eat a treat, anything that you consider a reward for your efforts. So here's some textbooks. There are multiple textbooks, but these are a few suggestions. Breastfeeding Answers by Moorbacher. I've just had been able to dive into this particular book. I love it. Breastfeeding in Human Lactation by Wambach and Spencer. Breastfeeding Atlas by Barbara Wilson Clay and Kay Hoover. And just to pause on the Breastfeeding Atlas, the Breastfeeding Atlas contains pictures. And also, along with the pictures, help you think about how to look at the pictures that you may be presented with. There's also Interdisciplinary Lactation Care Core Curriculum, and then Breastfeeding, a Guide for the Medical Professions by Dr. Ruth and Robert Lawrence, Doctors Ruth and Robert Lawrence. So Angela, after going over those book suggestions, I'm going to hand it over to you to get into some of the nitty-gritty details.
Oops, thank you so much, Sekeita. So yes, I echo what Sekeita said about the textbooks. And actually, if you go to the LER website and go to our bookstore, you may be able to find a discount for some of those books, and especially the Breastfeeding and Human Lactation and Breastfeeding Answers. Coming soon, we will have a link on our website in our bookstore so that you can receive a discount on purchasing those books. So just 1 second, I think there was a question about the handout for people who are on a phone. Apparently, if you are on a tablet or a phone, you may not be able to see the handouts. And so if you are having any difficulties receiving the handouts, please do email us, support@lactationtraining.com, and we're more than happy to provide the handouts for you. Okay, great. So now we're going to talk about the structure and strategies for actually taking the exam. So a few comments about how to remember. So mnemonics is a really nice way to remember concepts and different words in different orders. For example, the latch system, LATCH, was developed to help breastfeeding workers remember what to look for. So L stands for latch, A stands for the audible swallow, T stands for nipple type, C stands for comfort, and H is the amount of help that a person needs in order to latch the baby onto the breast. And so the latch score actually is a 0, 1, 2. So you can actually number, for example, whether or not you could hear an audible swallow. 0 would mean no swallows. 1 would mean barely swallowing or swallowing occasionally. And a 2 would mean you notice the active swallows. And so the latch score is a scale from, I believe it's 1 to 10. And that's one way, for example, that one lactation care provider can communicate with another one, is sort of a standardized way so that you can know whether or not, did the baby nurse well or not. And so the latch score is actually a validated tool, but it's also a nice way to remember those things that you want to look for whenever you're assessing someone and their either breastfeeding or chest feeding. A previous student made a great recommendation on how to remember which hormones come from which part of the pituitary gland. And so it's PAP, so PAP, which stands for prolactin, comes from the anterior pituitary, right? Prolactin comes from the anterior pituitary, and OPP is oxytocin, comes from the posterior pituitary. So PAP and OP are ways to remember which aspect of the pituitary gland secretes which hormone. Also, you could make up a sentence in order to remember different concepts that you need to remember, like a list of things. There's this old sentence here, which may be from your biology class. Maybe I'm showing my age here, but this sentence, an old Olympus towering tops, a Finn and German viewed some hops, which stands for each one of the cranial nerves for infants and for anybody, but it helps you to remember what those cranial nerves are. And so you can see each, so on is for olfactory, old is for optic, Olympus is for oculomotor. So then you can take each one of those letters in the first word, in the first letter of each one of those words, remember that sentence, and then you can correlate for all of the different nerves, the cranial nerves. So it's just one way to do it. Another way that you can do it in order to remember lists of things is to rhyme. Making up different rhymes for yourself may help. Also, you may want to divide, for example, these cranial nerves, there's 12 of them. You may want to divide that into groups of 3. We usually seem to remember things which are listed in 3. And so that's one way that you can do it in order to try to remember some of all the stuff that you have to memorize. So now, another idea in order to help you to prepare for the exam is to take practice exams. And so I'm actually going to switch and change the presenter so that you all can get a sneak preview of our new QBank interface. It'll be showing up in just a minute. So LER is super excited to announce today that we have a new way of taking practice exams, and that is called QBank. And it's really a fantastic interface so that you can answer, so that you can actually go through and simulate the questions that on the IBLCE exam in a really nice way to practice. So this is a fantastic way. So this just shows you this new QBank interface. You can actually access this interface through the LER website with our exam review or our exam review enriched. And so in order to take some of these practice exams, what you do is you queue up your first test. So go to QBank, which Jeanette has done here, and turn off tutor mode. So there it's pointed to where she's turned off the tutor mode, and you want to set it to untimed. So you want it to be an untimed exam. And then what you want to do on the next screen is choose how many questions you would like in each category. So we actually have all of them divided up, all of the categories for exam questions based on the IBLCE detailed content outline. And so, for example, we've got clinical skills, we've got pathology, we've got technology, we've got advocacy, legal issues and such. So we have all of those different things that you'll be able to check from. And then once you do that, and I know that we're having a little bit that the screen went away, but it'll be back in just a moment. Once you do that, then you're able to choose, let's say you want to do 2 questions from clinical skills and you want to do 2 questions from pathology, but let's say anatomy and physiology, oh my goodness gracious, you really want to study that one a little bit better, or even communication skills. Let's say that it's not something that's part of your current job in order to, interface and communicate with people. And so you could also do communication skills. And so you choose the number of questions that you want from each one of these categories. And our recommendation is to only choose a few. So you just want to choose a couple from each one, and then that way you can sort of practice. And so here we go. We are on untimed, and we have turned off tutor mode, and there. And now we're going to decide, we only want to do maybe, I would suggest doing 50 questions in your first time, but I think for the purposes of just seeing what we're going to do, we're only going to do 10 total. So we don't want to do a lot of questions because we just want to show you what this interface looks like. And then you click on create test. And there, now we've got this test, and Jeanette's going to press the button. And here we go. We've got a question. Now, it's really going to be hard for Jeanette to do because she is an IBCLC, but she's going to try to answer these questions quickly as opposed to correctly. And so what she's done here is she has gone to, yep, just pick any one of them, Jeanette, great, and then submit it. And then she can choose another one and she can submit that as well. The nice thing about this is that she can also mark a question. So let's say that, oh, she really doesn't know what this one is and she wants to go back to it before she hits submit, so she marks it. And then she can go on to the next one. And the IBLCE, the actual exam, has the same thing. And so she's still going to go through, she's at 5 of 10, so she's going to go through. So we even have pictures in some of our questions as well. And so she's going to choose pictures. She's just going to choose any answer. And then once she is done with, she's going to mark that one too, because she's not so sure about that one. And then she's going to go to the last one, just pick anything. I know this is so hard just to pick. And then she can, there we go. So this is what she's answered. Now there's those couple that she's marked. And so she could, if she wants to, she can go back and look at those before she hits that review button. You see, and there she goes. So now she can take a look at them, make sure, well, is this really it? Yeah, I'm pretty sure that one's the right one. Do I really want to do this? No, I really think this one's the right one. And oh, no, I'm wrong. I want to change it. So there she goes. She changes it. Okay, good. So now she wants to review again. And now she's going to end the section. And then, are you sure you want to submit? Yes, she's sure she wants to submit. Okay, look at the score. So here, the first time that she took it, I think I can read where she got about a 20%. You see what happens when you go too quickly. But then you notice the ones that she marked. So there are 2 that she marked that she really wasn't sure about. And look, she can now see, oh, you know what? I really wasn't sure about either one of those. And so she can click on it and find out what the actual answer was, what she answered, what it should have been, and she can also receive the information. So this is not just a test so that you see, oh my goodness, I got 20% and just be all sad and depressed about it. Now here's a fantastic opportunity to learn. And through this opportunity to learn, she can say, oh, there are page numbers there. So we currently have referenced the breastfeeding and human lactation, both the 2016 version as well as the 2021 version, the core curriculum, the 2013 version, as well as the 2019 version, and the Moorbacher, the breastfeeding answers version from 2020. So we have all those page numbers which are there. And so we give you the answer, we've got the page numbers to help you, so then you can go and you can study. And one thing I find whenever I'm studying something for an exam is that if I see page numbers, I will actually take a look at the information both before and after, because sometimes it helps when it's in that context. And so this is the QBank interface. This is the reason why we've all been really excited about QBank. Take a look not only in our newsletter, but also in emails. We'll be sending out emails to people to let people know that QBank is ready to go. Okay, there we go. So now let's get back to the presentation. There we go. And so that was just showing you what QBank looks like and how you can take that first test the first time that you actually get access to it. And then once you do that, then later on, you can choose tutor mode. So let's say maybe about 10 days into studying, you decide you want to do tutor mode. And in that tutor mode, then you can kind of go back and forth, and you can learn a little bit more, you can practice a little bit more, but your scores will not be submitted, right? So in other words, you're going to get this rolling average of what your scores are so that you can see how you've improved over time. And so the next time you maybe take an exam, you want to just take maybe 50 questions in tutor mode. And then let's say that you really want to get a good idea of what the exam is like. You can take 175 questions in test mode. You can time it, and that's going to help you to simulate the IBLCE exam. And so QBank is a fantastic way to help you to get ready for the IBLCE exam. And we're so excited that we have it. So another way when you're studying for the exam is to know what's normal. So you want to know the normal infant weight gain. You want to know the normal stages of development. And the reason why you want to know what's normal is so you can know what's abnormal. So let's say that you don't necessarily work in a hospital and you have no clue how much a baby typically weighs at birth. Well, there's something to study up on. And so know what normal infant gain looks like, that it's about a half an ounce to an ounce a day. Know also things that, we expect for babies to lose a few ounces or so, or a few grams in those first few days, but then we expect for them to regain birth weight by 2 to 3 weeks. 3 weeks is only in certain situations, but you do want to know that which is normal and the normal stages of development. When do babies typically start to take things and put them in their mouth? When do they start to follow things? Approximately what age? When can they stand? When do they stand unassisted? Those are the things that you want to know from a developmental perspective, so that when things are abnormal, you'll know when you need to intercede. Explain yourself. So as Sekeita mentioned so beautifully earlier, you want to study difficult topics with each other, especially those who don't know anything about lactation. And so some ways in order to explain some of the more complicated issues is to pick a friend or a colleague who may know nothing about breastfeeding or may know nothing about lactation, and have your flashcards, get your flashcards out as far as, let's say, the neuroendocrine arc for breastfeeding. And let's say that you find someone, not just some typical random person, walking around. You want to find somebody who could be sympathetic. Pull out your flashcards, use general terms, and try to explain something like the reason, the hormonal reasons for lactation, the reasons why, what activates the secretory response of the mammary gland. If you can explain that in simple English to someone who doesn't know anything about breastfeeding, then you understand it. Then you've mastered it. If you can take a complicated concept and simplify it, then you've mastered it. And so finding some good friends who will listen to you as you try to explain these things will help you to learn better. Also get a picture and start to describe it. And so if you can take a picture and start to describe it, let's say the feedback inhibitor of lactation, then it's another nice way for you to understand the concept yourself when you explain it to others. So the actual exam content, so the exam will consist of 175 questions, all multiple choice. Some are regular questions like you saw in the QBank, and you noticed also in QBank that some of them are related to pictures. Approximately half of the exam questions are going to be picture-based. And so you will understand that the question on the exam are often referred to as items. So they're not questions, they're called items. So if you hear us using that term, just know that it means the same thing. You will have 4 hours to complete the exam, or 240 minutes. There will also be case study questions, but even the case study questions are going to have multiple choice responses. So each item is made up of a stem, which is the actual question, and then several choices. Usually it's 4. The stem of the item can be phrased as a question, a partial sentence, or best choice. In this example, the stem is about the onset of copious milk production. It can be phrased as a question. What is the stage when copious milk is produced? Or a partial sentence, which is the onset of copious milk production is called, or it could also be a partial sentence. It could be a best choice question. I apologize. What is the best description of the onset of copious milk production? They're all asking about the same concept, just in a different format. And the choices in this example are lactogenesis 1, lactogenesis 2, lactogenesis 3, and lactogenesis 4. So the first thing you want to do is answer the question mentally. So read the STEM and then answer the question mentally and think about what the correct answer would be. Read all of the choices. Then you can eliminate the ones that are not correct so they don't distract you. And then you can concentrate on differentiating the choices which are left. Tentatively choose the first answer on the list that seems correct, then compare the other selections to that one. So if there is a better answer, then select that one and continue on. Maybe another answer would be even better, but do a final check to ensure that you read the question correctly. If you don't find one that you think is correct, you're looking at all the answers and you're like, none of these are right, I wouldn't do this at this time. Stop, take a moment, take a breath, and read the STEM again carefully to make sure that you understood. The perfect answer may not be one of the choices, so choose the best one. And if you're not sure, do venture a guess. There is no penalty for guessing, or for getting questions wrong, I should say. So note all of the information in the STEM. All of the information in the STEM is probably there for a reason. The distractors are in the possible answers, not in the STEM. So that's where you're going to find that distractor piece. Watch for words that change the meaning of what came before. Words such as but, however, although, even though, while, despite, in spite of, or regardless of. You want to watch the context of the question. An answer can be right, but not correct in that situation whenever you see one of these modifiers. So read the answer choices. Choices are going to fall into three categories. One is a sophisticated distractor or an unsophisticated distractor. An unsophisticated distractor is something easy that you would know anyway, and something that's obvious or something that's obviously wrong. And then there's the correct answer. So there will be three choices to eliminate. Sekeita, what do you think? First impressions, is that usually the best way to go?
Absolutely. So, Angela, thank you so much for discussing the STEM because that just gives a really, really clear introduction into this first impression section. What you want to be careful of is to what I call a knee-jerk response. You start reading the question and then you all of a sudden like, yeah, I know the answer. You want to make sure you read the stem of the question all the way through, then each possible answer all the way through. Indicate your answer. And when we talk about first impressions, remember the first answer that you think it is most likely the correct answer. Try not to second guess yourself. Try not to read more into the question than what is there. Angela has given real specific information about distractors and words and how to think about words. Really pay attention to what the question is asking. Use the options themselves to provide you with hints about things you need to know. And the other thing you want to be mindful of is the questions that are, or any STEM that has an always scenario. Rarely is there any situation in lactation that will fall into an always category. So usually, and most of the time, the answer is always no, it's not always. There will not be any of the type of all of the above choices for answers. They are generally easy to answer and don't really show you the material real well. If there's a question that you have absolutely no idea, make a guess and flag that question. And QBank shows you exactly how that process looks like. And so flagging the question, you can go back to it. You can do this easily with the computer-based testing. And you can go back after you've completed everything. Again, I can't stress this enough. Remember, your first impression is usually right, so be reluctant to change your answer. So let's say you marked it and then you go back to it. unless you have had a flash of inspiration, or unless you're a visual person and all of a sudden it just popped in your head and you've got it, you know it's wrong and you have the right answers, then change it. But I know I have experienced this, and I'm sure many of you have probably taken an exam before, changed your original answer only to find out that you had it right before you changed it. And I have done that, and it is the worst feeling. Even when I pass, it's still like, oh, why did I get that wrong? I should have kept my answer. So you want to avoid that, in this instance. Angela spoke about guessing. So when to guess. When taking a multiple test choice is so important to, and these are really test taking strategies that we're discussing to know when to guess. If you're uncertain, what you want to do is eliminate the options that you know are definitely wrong, and then make your choice. Then flag the question again so that you can reconsider it at the end of the exam if you have questions. And if you really have just absolutely no idea, just remember, you have a 25% chance of being correct by guessing. And if you can eliminate at least one option, then you increase your odds to about 33%. If you're not sure about a number answer, so there are questions where there may be values of numbers, toss out the high and low and consider the middle ranges. If you have no idea of the answer, check for lookalike options. Check for the most inclusive option, the option that contains the most information. Think about what it might be similar to. Anything you have seen or read about that was sort of the same, related to what you know, and you can make an educated guess. If one of the options is totally unfamiliar, be suspicious. Something that you have never heard about before or seen unrelated to the STEM, this is likely to be a distractor. What Angela was talking about earlier. There are words on there that you're like, what? Just ignore those words if you've never heard of them. Some exam statisticians recommend setting up a predetermined strategy for guessing on the questions that you are clueless about. So after you eliminate the wrong answers, always select the first option or the last option. It's up to you. But if you always select the answer in the same position, then you increase your odds that your guess will randomly be correct. Picture items, picture items, picture items, picture items. So about half of the questions will be based on a picture. With pictures, to keep this in mind, you may have to define a diagnosis or a condition. And Angela spoke about knowing what's normal, because in pictures, you also have to sometimes distinguish between normal and abnormal. You may be asked to determine a child's age just by their posture, size, or behavior. So those developmental milestones that Angela spoke of earlier. Define a problem. You might have to define a problem, absolutely, just by looking at a picture. For example, if you're shown a picture with what's called a compression stripe on the nipple due to a shallow latch, or this example in this picture, asymmetrical breasts. That's how you would determine, and looking at this picture, if that was a choice, that's your answer. A picture may be used in a case study where you're asked to recommend a care plan and decide what you would recommend first or next. And again, it's so important when you are looking at pictures, try not to read more into the pictures as well. We talked about not reading into the question, but look at the picture for what it is. Try not to look at common things in the background that could be distractors, such as, for instance, this picture with a baby in it. Moving on to some more pictures. Next slide. When answering a picture item, read the question first and then look at the image. So try not to look at the image, because sometimes when you look at the image, you can already think you know the answer, and it sets up a whole different thought process. Read the question first and then look at the image. The question will define what the purpose of this particular picture is, and you will be able to focus on what the question is referring to faster. And remember, this is a time test, and so you really want to be able to get through all of the questions. If the answer is not immediately obvious to you, visually divide the picture into quadrants. Just divide it and look at each quarter of the picture closely. Images may not be as obvious as the picture on the top, which is really massive mastitis. A more likely image is the redness seen up under the nipple on the image on the right. It's a little bit more subtle. So read the question first, look at the picture, read the question again, and look at the image one more time, and then choose the right answer. So, what are some common problems that test takers run into? First, again, like I said, reading too much into the question. Most of the questions are face value. That is the question. There are distractors in the answers, but remember, take it face value. Don't look for zebras in New York City Central Park. Look for the most common likely answer. That's it. The most common, the best likely answer. So someone who took the exam last month said the likelihood that parent or baby is presenting with something rare or exotic is very low compared to the likelihood that it's, let's say, mastitis or plug duck. So prepare yourself for everyday scenarios. Most common problems, everyday scenarios. If you get stuck, it's okay. I've had a couple mind breaks during this presentation. It's okay, reset. So just take a deep breath, relax your shoulders. I like to say do a body scan, because sometimes we carry tension in our shoulders. Some of us carry tension in our backs. But when you're taking that cleansing breath, just kind of do that body scan, release the tension, and go back into it. Think of real life situations that may be similar to one of the questions, and if you have any clues. And then the other thing is we use common sense. The exam writers, they're not trying to trick you. They just want to show that you know the material. So read the stem and the question again. Look for clues in the adjectives or qualifiers. And if you're totally clueless, remember, you can always guess. So I know that's a lot, but again, just when all else fell, just breathe.
That's so
Angela?
wise. That's so wise, Sekeita. You're absolutely right. So now I'm going to go over a little bit more about the exam content and how IBLCE actually creates this content. So the exam content is the exam is a reference-based exam. Well, what does that mean? It means that it's based on the current medical literature. It's based on the literature such as current textbooks. Take a look at the compendium of research that has been validated, peer-reviewed, and in the pipeline for over the past few years. The Academy of Breastfeeding Medicine, their protocols, is a great way to study for the exam. I will note that if you're familiar with the ABM protocols, the Academy of Breastfeeding Medicine, the website is bfmed.org. They've actually changed how you access their protocols, and you have to sign up for a free account in order to access the protocols, but they're still free. So do take that extra step, sign up for the protocols, and then that's a fantastic place in order to get more information about specific subjects such as infant sleep, hypoglycemia, preparing for discharge, etc. So things that are not going to be included on the exam are unvalidated research. That means that an additional study has not been done to support the conclusions of the first piece of research, or additional research did not support the original study. Anecdotal materials, verbal statements, websites, and conference presentations are not going to be on the exam, especially if they're just one-off pieces of information. Only things that are written in a peer-reviewed journal are included. The textbooks that we suggest are evidence-based textbooks, such as Breastfeeding Answers and Breastfeeding in Human Lactation. It's important not to go down a rabbit hole and think of the ifs and the buts when you're sitting the exam, when you're taking a look at different presentations. And the reason why is, if you're looking at an exam question and you don't think that any of the answers are there, you may take a look at it and say, well, the right answer isn't here. Or I knew of a case where that wasn't the situation. Remember, we're not looking at those zebras, right? We want to take a look at the horses. And so we want to take a look at what is most likely. Don't go down that rabbit hole. So the exam covers all of the topics as they relate to breastfeeding and lactation. So you can go to the IBLCE website, the IBLCE website, which is in your handout, and we have a link to the detailed content outline. That's what this is. This is the detailed content outline. And you can print it out if you'd like. I knew one group of candidates who created a Google Doc, and others, and then allowed everybody just to sort of contribute to it. So for example, when you see something here like immunology and infectious disease, well, what goes under that? That's a huge topic. What goes under immunology and infectious disease? Well, COVID-19 would go under that, right? Tuberculosis would go under that. HIV would go under that. The common cold, the flu, those are things. And not just for the parent, but also for the baby. And is there a difference based on the age of the baby, right? So those are the things that are going to go into immunology and infectious disease. And the nice thing is that if you've got that Google Doc and everybody's contributing to it, then it's an easy way to sort of like study it, sort of like an abridged way to study. I once met someone a few years ago at a conference, and they were getting ready to sit the IBLCE exam, and they had taken that Google Doc and they had printed it off and they had it in their conference bag, and it was like, I don't know, about 40 or 50 pages by the time they had printed out the document. So it was a really helpful thing for them to use in actually studying for the exam in those last few days. So here we've got some data from the 2019 exam, and I created these tables so IBLCE actually publishes their test analysis report. And what they did was they published this broad overview on exam performance a few months after the previous exam. So I have this information to show you how well most people do by cohort. So notice that most people pass the exam. In April, 81%, and in October, 72% of people pass the exam. So what's the difference between April and October? Well, in April, it's only given to people whose mother tongue is English. It's only provided in English. So if your mother tongue isn't English and yet you speak, you can, read the exam and sit the exam in English, then you can take it in either April or October. But if you need the exam to be in your mother tongue, then you may need to wait for the October exam. Therefore, the test scores are slightly lower in October than they are in April. And I think one of the reasons why, and this is just my theory, one of the reasons why people who are sitting the exam in their mother tongue or not, or if English is not their mother tongue, I think the reason why is because of the amount of textbooks which are translated into any specific language. So for example, if your language is Hungarian, and you only have one textbook that was translated into Hungarian, and that was 5 or 7 years ago, and there's only one textbook, well, then you may be missing the stuff that's in the other textbooks. It doesn't mean that that textbook is incorrect. It's just that there may be newer data which either isn't covered in that specific scope of that textbook, or it may be found in another textbook, or it may have been found in the revised version, but you don't have access to it because you speak and read in Hungarian. Hopefully that makes sense. So taking a look at this data again, you'll notice that in the recertification by exam group, that data is slightly skewed. Those who are taking the exam at the 30 or 35 year mark, and there were 14 of them here, 100% of them passed. And so, but regardless, that cohort scored best on the exam. And it doesn't hurt that they've probably taken the exam, or I know they've taken the exam more than one time. The questions are not the same, but these people have been around for a minute, and they probably are the lactation educators, which teach all of us. And so, as most mentors will tell you, students keep us fresh on our toes. They will ask questions all the time about the latest evidence, and so that really does help me as a mentor to be up on my game. So now I've got this slide, which I actually broke down the data and taking a look at the exam results from all candidates over 2 consecutive years. Now, do note that it's 2014 and 2015. I know that's old information, but the test analysis report used to provide this granular data, and it currently does not. And so you, though, can see how each one of these different disciplines and how they scored over 2 different years. So you want to look at those topics that scored below 75%. That was that immunology and infectious disease that I mentioned before. Also note that growth parameters and developmental milestones usually doesn't perform as well. And again, I think if you are, let's say, someone who's working mostly with people, either pregnant people or people who are in that perinatal period, so like immediately prior to birth as well as the first 5 days, they may not see a 2-year-old and be able to identify what developmental milestones a 2-year-old is likely to exhibit. And therefore, that's, I think, one of the reasons why. Also, conversely, let's say that you only work with older kids and work with children in the community. Then some of the information which is out there on developmental milestones or those growth parameters in the first few days may not be as familiar to you. And so that may be a spot where there's hiccups. And so note that this is where these 2 different cohorts, where they did really well and where they didn't. Notice that there was also this slight shift here in pathology, which dropped, pharmacology and toxicology, which improved, psychology, sociology, and anthropology, which declined, and interpretation of research improved. So there are areas, the areas where most people score lower and or where you score lower based on your information from QBank, those are the places where you really want to focus. A common question is, what do I study? Well, you want to study those areas, but also take a look at the number of items that were presented in each one of these 2 years. So you can see, for example, how the test is weighted. So let's say that interpretation of research is not your jam. Well, take a look. In 2014, there were only 6 questions on it. And in 2015, there were only 4 questions on interpretation of research. So if interpretation of research isn't your thing and you're really struggling to remember qualitative versus quantitative and the significance of a p-value, do study it now because we're 90 days prior to the exam. But if you are listening to me 3 days prior to the exam, take a look at this information and rest assured that even if you miss every single one of those, but you are amazing at anatomy and or physiology, then chances are those better scores are going to carry you through, and you won't have to worry so much about those areas that you're not as familiar with. Also, the exam covers all of these chronological areas. So it is important to know each one of these from preconception through toddlerhood. And then there's also the majority of questions we find are clustered in the early newborn time frame. But again, it depends on what IBLCE decides should be on that exam that year. And here are some test scores for those chronological stages. So again, you can see that there are some areas of improvement, such as within that 15 to 28 day group, and there's a decline, such as in the prenatal setting. And it appears that candidates are very good at the first few days, but seem to have difficulty with older babies. So find or ask for pictures of babies and stages that you don't currently work with. There are a couple of online resources, such as Stanford University in California in the US. They have a library of pictures. The CDC also has a fantastic library on developmental milestones, and it has both parent-facing as well as healthcare professional-facing documents. That's really helpful to find, and you can take a look at or actually the Breastfeeding Atlas. Take a look at those pictures, don't find out the context, and take a guess at how old that baby is and why. Or study up first and then start to take a look at pictures. And if you're not experienced with older baby, possibly you could go to a new parents or a support group, let the facilitator know that you'd like to attend as simply an observer. And if you're welcome there, then you can take a look and see what babies are doing what things at different ages. And again, not only in person, but also online. You can see kids that are running around in the background, and you can sort of try to get an idea as far as how old they are and take a note at what they're doing. So most importantly, don't panic. You may be asking yourself, well, what should I know that I don't know that could be on the exam? Remember, you're starting now. You will be prepared. Believe in yourself. Haven't the families that you've been working with so far benefited from the wonderful suggestions and information that you've provided? You want to pace yourself. Take the vocabulary words wherever you go. That's why we suggest that old school suggestion of flashcards. Take those wherever you go. Use little pockets of time to study. You never know, for example, when you may be either, I probably shouldn't say this, but I will, stuck in traffic. Or let's say that you're waiting in line somewhere and all of a sudden there's a kerfuffle happening and you know that your wait's going to be that much longer. Well, then you've got your whatever you need in order to study, and you don't want to necessarily need to rely on the internet or rely on electricity. I was chatting with a friend yesterday and they were studying yesterday when their car broke down and they had to wait 3 hours and they had to take the metro and then a long commute home. And so when they did that though, and their phone was only on one bar and was in the red. And so they didn't have their phone to be able to rely on to study for the exam, and they were really grateful they had their flashcards. You also want to watch yourself for excessive stress. Symptoms can include mental, social, and physical problems. Mental stress can show up as being forgetful or confused or agitated, even spacey. Social stress can show up as being irritable or argumentative or withdrawn. Stress can show up in physical problems such as cold sores, bladder infections, eczema, GI upset, or even catching a cold. Do whatever works best for you in order to reduce that stress. Thank you very much for listening today. And now we get to listen to you. So please, hopefully you've put a few questions in there. And so Sekeita and I are going to take a look at the questions and go from there. Sekeita, did you see anything to start with?
I did. So there's a question that says, what's the passing score for this year's exam?
So the answer is we don't know. IBLCE sets that. And I wrote a blog post a few months ago about exam scoring, as well as why does it take so long to get the test results when I take it on a computer. And so do take a look at that, but IBLCE sets it. They usually set it somewhere. It depends on how they actually psychometrically take a look at the data and take a look at how each question performed, and to see if it performed in order to discern whether or not the person was actually understood the question and was actually able to interpret that question as well as they needed to in order to have that question be a good discernment for whether or not the person knows the information. And I know I just said a bunch of words in a circle, but basically they take a look at it statistically and then they decide, and then they will set the pass rate. It usually ranges anywhere from, I want to say 74 to 78%. Is that your recollection as well, Sekeita?
Yes, absolutely. Yep. Yeah.
And so there is no exact.
Yeah. So someone asks, on the actual exam, can you flag questions? Yes, you can. That is the why I love that we also have that with QBanks. So it gives you kind of an idea of how it works. And so when Angela and Jeanette were giving you the rundown on how QBank works, I was thinking, okay, you can set a timed test, right? Mark your questions, go through it, and really do a simulation of what the exam could be like if you have to mark questions or if you have to guess. So absolutely, you do have that on the exam where you can mark those questions.
Somebody else asked earlier about the textbooks that we suggested, and remember that we don't necessarily recommend these, and say, oh, if you study this one book, then you're going to pass the exam, right? We don't say that necessarily, but there are textbooks that we have found, that Sekeita and I have found helpful in our practice and in our study for the exam. Also, Julie and Kim and Jeanette, who are on that call as well, who've sat the exam. We talk about these things because we have a lot of IBCLCs and La Cheerlead leaders and certified breastfeeding specialists on staff. And so we do talk about this. And so the books that were on that slide are Breastfeeding Answers by Nancy Morbacher. Someone asked if the first version of that would be helpful, and as Julie noted in the chat, that first version, which has a white cover, is 10 years old. And so it may be good to think about upgrading and getting one that's a little more recent. And I will tell you, as someone who loved the first edition, the second edition I love as well. And there is new information in there. I mean, I'm just blown away by the information that's in there. It's 6 pounds, for heaven's sake. So how many kilos is that? That's like, you know, right? 10, 12 kilo. I don't know. I just tried to do math on the fly, and that's not a good idea. The second one that we suggest is Breastfeeding and Human Lactation. The Breastfeeding Atlas by Kay Hoover and Barbara Wilson Clay is a great one. The Interdisciplinary Lactation Care book, which is also known as the core curriculum. It lists everything in outline form, whereas the Breastfeeding Atlas has a lot of pictures and they do case studies. And then finally, Breastfeeding, a Guide for the Medical Profession, which is by Dr. Ruth and Dr. Robert Lawrence. That is one that I usually recommend for those who are working in the health professions. The language is focused specifically on providers, so on advanced practice nurses as well as physicians who work all across the world. And so it has that feeling to it. Whereas I find Breastfeeding Answers to be something very accessible for people who don't necessarily come from a medical background. And remember, you don't have to come from a medical background to sit this exam.
Absolutely. Angela, there's a question, and I really believe it's referencing QBank, and the question reads, can we take and retake the test?
So yes, you can take and retake the questions, and actually the tests. And actually, I know that there are some. Let me just check here in our chat. There was an answer to that Julie had. And so what happens is that if you retake the tests, the answer that is incorrect, if you answer a question incorrectly, that goes back into the QBank. If you answer the question correctly, that you no longer will be presented with that question because you already know it. That said, you can go back and relook at the test that you've already taken. So it's going to remember, oh, I took a 50 question exam today, and then I took a 10 question exam 3 weeks ago. So you can go back and take a look at those. But as far as you practicing for the test, it's only if you, only those ones that you got incorrect are going to pop up again. Now you can do a reset. I think we can do one reset where you can reset and basically say, okay, I want to reset everything. I want QBank to forget what I've gotten correct and what I haven't gotten correct, and I just want to take them again. Currently we have, I want to say 370 questions in QBank. I know that a bunch are coming in. We've got item writers all around the world. If you're interested, we'd love to have you. But we have item writers all around the world who are actually writing questions for the exam. And we literally will get them on a daily basis. And so we are constantly updating it. So please know that we have a lot of questions which are there, and you can do a lot of really good practicing in QBank. Let's see.
I didn't see any more flagged questions, but that doesn't mean that someone is not typing.
Right. So we had questions. So QBank is available now, and it's in the exam review and the exam review enriched. The Facebook group is available for people who have purchased either the 90-hour course, the core course, the bridge course, or our exam review course. Then you can be added to that Facebook group. And the Google Doc that I mentioned that people were contributing to, that was something that was just for that one Facebook group. And it was interesting. I had suggested it to the next, the next cohort of people who were sitting the exam, and they didn't set it up. And so it's not something that we set up. It was something that the students really wanted to do. And so, and we also have IBCLC, so people who have passed the exam who are in that study group. And so they will answer questions based on their clinical experience as well. And so it really can be helpful. It's a really fantastic group for those of you who are on Facebook. Okay, great. I think that's good. I don't think I see any other questions. Let me check the chat here, check our internal chat. Oh yes, thank you very much, Wendy. Flashcards are in both of the exam review courses, so both in the exam review basic and the exam review enriched. and you can flag questions in the IBLCE exam just like in QBank. And there are 2 handouts available under More, or you can email if you're on a smart device. If it, under the More, if you go to your phone and you say More, then the handout should be found there. Or you can email us at support@lactationtraining.com, and we can get those handouts to you. Not a problem. Also, if you're watching this later on our website, as I mentioned, if you're watching it on our website, on the top right corner, it should have resources, and both of the resources will be there. Or if you're watching on our YouTube page, it should be down in the comments, and we'll have both of the resources available for you. If you have any questions specifically for Sekeita and I, do email support@lactationtraining.com, and they will forward the question to us. Yes, the flashcards are able to be printed. The Facebook group is IBLCE Exam Study Group, I believe. And the difference between the 2 exam review courses, if you go to our website and take a look, it's got a really nice interface there. So you can see exactly what's in each one of them. The main difference between the 2 has to do with recorded webinars. So there are 32, I believe, 25 or 32 lessons that are webinar based like this, that actually go over each individual section heading in the detailed content outline. And so I do some of them. Our former program director, Virgie Hughes, the founder of the company, she does some of them as well. And so we go through, there are worksheets which are available that are super helpful. So that's the basic difference between the 2, is that it's these 32 webinars that you can listen to. Okay,
There's a
great.
question about YouTube videos. There's so much on YouTube.
Oh my gosh, we have
So
we
the
have
only
really
thing
good
I'll
stuff.
say about that is be careful of the information, because there's so much information, but there's also a lot of good videos on YouTube. So the way I think about YouTube is the same way I would think about any other reputable source. If it comes from like a major what's considered a authoritative area in your country, or for instance, like if I saw something on YouTube from the Academy of Breastfeeding Medicine, I'm like, okay, yes, right? Versus if I saw something about Mojo's views, I might be like, oh, no, that's not videos I want to watch, right? So, think about YouTube in that people post what's important to them, and sometimes there's a level of bias that may not include all of the information. So be really careful on, those YouTube videos. But you can YouTube anything. So
You
that's what
can.
I'll add.
And really the reason that Sekeita and I mentioned our background in the beginning has to do with, we've been doing this for quite some time. This is not just a flashy help you pass the IBLCE exam based on, things and strategies that may work for a general exam. This is us knowing the process, being invested in the process, and frankly, being invested in you and wanting you to pass the IBLCE exam, because there are 32,000 IBCLCs around the world. We need more. There are a lot more babies and a lot more families that we need to support and to serve, and we want you with us. So please, let us know what we can do to support your journey and to help you pass that exam.
I second that, Angela. Well said. Well said.
Thank you all very much for your time. Do appreciate it.
Yes, thank you, and best wishes and good luck to you. And remember to breathe. Bye.